So, today we are discussing about pharyngeal arches. These pharyngeal arches include ectodermal clefts. These pharyngeal arches includes ectodermal clefts, endodermal pouches and mesodermal arches. These three constitute the branchial apparatus. So, these are the mesodermal arches, outside covered by ectoderm and inside lined by endoderm. These are the mesodermal arch. Pharyngeal arches are nothing but the mesodermal arches which are covered by ectoderm and lined by endoderm. Which are covered by ectoderm here, and this one I have represented with blue color, and they are lined by endoderm I have represented with red color, and the mesodermal bars I have represented with green color. So these constitute the branchial apparatus. So the branchial apparatus consists of ectodermal clefts, mesodermal arches and endodermal pouches. These three constitutes the pharyngeal arches. These are the mesodermal arches that extends ventrally and medially along the floor of the primitive pharynx. Along the floor of the primitive pharynx, they extend ventrally and medially from the hindbrain vesicle, and they enter into the mid-ventral line, where they meet the opposite arch of the same side, So these are the mesodermal arches which are lined by ectoderm and lined by endoderm, which is covered by ectoderm and lined by endoderm. Okay, then we have to discuss regarding what is the fate of the ectodermal clefts, what is the fate of the endodermal pouches. These are the endodermal pouches and these are the ectodermal clefts and these are the mesodermal bars. We have to discuss what is the fate of the mesodermal bars, ectodermal clefts and endodermal pouches. Out of these 6 pharyngeal arches, 1, 2, 3, 4, 5, 6. Out of these 6 pharyngeal arches, the 5th one disappears. The 5th pharyngeal arch disappears. Out of these 6 pharyngeal arches, the 5th pharyngeal arch disappears. It is transitory. Okay, then we have to discuss about each one in detail. Okay, coming to the mesodermal bars, which I have represented with mesodermal bars of the branchial apparatus. So, what is branchial apparatus? They constitutes the ectodermal clefts, endodermal pouches and mesodermal arches. These three constitutes the branchial apparatus. Various structures of the head and neck, they are derived from this branchial apparatus. Various structures from the head and neck, they are derived from this branchial apparatus. These are the mesodermal bars situated in the floor of the primitive pharynx in the mid-ventral. They extend ventrally and medially, where from into the mid-ventral line, where they meet the opposite arch. Okay, then what are the branchial apparatus? It constitutes the ectodermal clefts, endodermal pouches and mesodermal bars. Now, coming to the mesodermal bars. So, coming to the mesodermal bars, each mesodermal arch cells are pluripotent. They may transform into nerves, they may transform into skeletal elements, they may transform into aortic arches, they may transform into muscle masses. Okay, so each mesodermal bar cells are pluripotent. Each mesodermal bar cells are pluripotent and they can be converted into aortic arches and they can be converted into muscle masses and they can be converted into cartilaginous elements or skeletal elements. And each mesodermal arch, each mesodermal bar, it is caudally, it is accompanied by a nerve which is called post-traumatic nerve, and cranially and caudally it is accompanied by a nerve called pre-traumatic nerve. So these structures constitute the mesodermal arch. Also, what are the structures constitute the mesodermal arch means? Each mesodermal arch consists of an arterial arch, muscle masses, skeletal elements and 2 nerves, post-traumatic nerve and pre-traumatic nerve. So coming to the arterial arches. So when we take the arterial arch of first branchial apparatus, we have take the arterial arch. The first arterial arch, you can otherwise called as first aortic arch. So the first aortic arch usually disappears and a small part remains as the maxillary artery. So the first aortic arch usually disappears except a small part which remains as the maxillary artery. We know that maxillary artery is a branch of external carotid artery. It's the terminal branch of external carotid artery. And coming to the second aortic arch, The second tier aortic arch also regresses, but a dorsal part remains as the stapedial artery. So the first aortic arch disappears and a small part remains as the maxillary artery, and the second aortic arch it is also regressive and a dorsal part remains as the stapedial artery. Okay. And coming to the third aortic arch. Its ventral part forms the common carotid artery. As well as stem, and dorsal part forms the stem of internal carotid artery. So third aortic arch gives rise to two arteries. One is common carotid artery and next one is stem of internal carotid artery. And coming to the fourth aortic arch. On the right side it forms right subclavian artery. On the left side it forms arch of aorta. On the left side it forms arch of aorta. We know that the fifth aortic arch, the fifth one disappears. So the fifth one disappears, and coming to the sixth aortic arch. On the right side, the ventral part forms the right pulmonary artery, and the dorsal part regresses. On the left side, it forms the left pulmonary artery, and the dorsal forms the ductus arteriosus. So these are the derivatives of the aortic arches. So each mesodermal bar consists of aortic arch, otherwise called as arterial arch, and we have muscle masses and skeletal elements or cartilage elements, and each mesodermal arch or each pharyngeal arch, it is traversed by two nerves, post-rheumatic nerve and pre-rheumatic nerve. Post-rheumatic nerve occupies the cranial part of the mesodermal bar, and pre-rheumatic nerve occupies the caudal part of the mesodermal bar. Okay, coming to the derivatives of the aortic arches. From the first aortic arch, so most of the first aortic arch disappears and a small part remains as the maxillary artery, and from the second aortic arch it is also degressed and a dorsal part remains as the stapedial artery, and from third aortic arch it forms the common carotid artery as well as the stem of internal carotid artery, and the fourth aortic arch on the right side forms the right subclavian artery, and the left side forms the arch of aorta. And coming fifth aortic arch disappears, and sixth aortic arch we have on the right side ventral part forms the right pulmonary artery and dorsal part regresses. On the left side it forms the left pulmonary artery and the dorsal part remains as the ductus arteriosus. What are these aortic arches? These aortic arches, they connect the aortic sac to the dorsal aorta of the corresponding sides. These are the aortic. What are aortic arches mean? They connect the aortic arch. So these are the dorsal aorta and this one is the aortic sac. So these aortic arches, they connect the aortic sac to the dorsal aorta of the corresponding side. Okay. There are 5 aortic arches which present. They connect the aortic sac to the dorsal aorta of the corresponding side. Okay, so these are the fate of the aortic arches. And coming to the nerves. So the mesodermal bar, it is traversed by two nerves. One is the post-rheumatic nerve and next one is the pre-rheumatic nerve. Usually the pre-rheumatic nerves of all the arches disappear except for the first arch. The pre-rheumatic nerve remains, that is the cauda tympani nerve. So the pre-rheumatic nerves of all the arches disappears except for the first arch which remains as the pre-rheumatic nerve, and each arch is supplied by the post-rheumatic nerve which are derived from the hindbrain vesicle. So what is the nerve of first arch? So the nerve of first arch is the mandibular nerve. The nerve of first arch is the mandibular nerve. So first arch nerve is mandibular nerve. Mandibular nerve, which is the post-rheumatic nerve. which is the post-rheumatic nerve, and the pre-rheumatic nerve of the first arch is the chorda tympani nerve, which is a branch from the facial chorda tympani nerve, which accompanies the caudal border of the mesodermal arch. Chorda tympani nerve. Okay, and the second arch nerve is the facial nerve. The second arch nerve is the facial nerve. It supplies all the muscles of facial expression. And the third arch nerve is glossopharyngeal nerve. Glossopharyngeal nerve, which supplies the stylopharyngeus muscle. And the fourth arch nerve is superior laryngeal nerve. Superior laryngeal nerve. And the sixth arch, we know that the fifth arch disappears, right? And the sixth arch nerve is recurrent laryngeal nerve. Recurrent laryngeal nerve. So, these are the nerves of the arches. So, each arch, it is traversed by two nerves, post-rheumatic nerve and pre-rheumatic nerve, and the pre-rheumatic nerve of all the arches disappears except for the first arch, which remains as the chorda tympani nerve. And the first arch, coming to the first arch nerve is the mandibular nerve, post-rheumatic nerve is the mandibular nerve, and the pre-rheumatic nerve is the chorda tympani nerve, and the second arch nerve is the facial nerve, which supplies the muscles of facial expression, and the facial nerve is the post-rheumatic nerve, and the third arch nerve is the glossopharyngeal nerve, which supplies the stylopharyngeus, which is the post-rheumatic nerve. Fourth arch post-rheumatic nerve is superior laryngeal nerve, which supplies all muscles of pharynx except stylopharyngeus, which is supplied by the nerve of third arch, that is glossopharyngeal nerve. And this superior laryngeal nerve, it also supplies the cricothyroid muscle. And coming to the sixth arch, the nerve of sixth arch is the recurrent laryngeal nerve. So these are the nerves of the mesodermal arches. So aortic arches is over and the nerves is over. And coming to the muscle masses, what are the muscle derivatives from the pharyngeal arches or mesodermal arches? What are the muscle derivatives from the pharyngeal arches or mesodermal arches? So first arch muscles are tensor tympani, tensor villi palatini. We have discussed the tensor tympani and tensor villi palatini muscle during the palate. And muscles of mastication, we know that the muscles of mastication are the medial pterygoid, lateral pterygoid, temporalis and masseter. Muscles of mastication, anterior belly of digastric, we have discussed them during the carotid triangle, we have discussed them during the anterior triangle of neck, anterior belly of digastric and mylohyoid muscles. These are the muscles supplied by these are the muscle derivative from the first arch muscle masses. So, what are the muscles derived from the first arch is tensor tympani, tensor villi palatini, muscles of mastication, which includes lateral pterygoid, medial pterygoid, temporalis and masseter. Okay, temporalis situated here, masseter is situated is here, and medial pterygoid and lateral pterygoid, they arise from the pterygoid plates and they are inserted to the mandible. And anterior belly of digastric and mylohyoid. Anterior belly of digastric is situated from the, it arises from the digastric fossa here, and mylohyoid muscle, it arises from the mylohyoid line here. Okay, so these are the muscle derivatives from the first arch. So all these nerves, what is the nerve of the first arch? That is the mandibular nerve, right? So the mandibular nerve supplies all these muscles. So we know the muscles of mastication, it is supplied by the mandibular nerve, and anterior belly of digastric and mylohyoid muscle, they are also supplied by the mandibular nerve, posterior division of the mandibular nerve, and tensor tympani and tensor villi palatini, they are also supplied by the trunk of the mandibular nerve. So the first arch muscle derivatives are these. And coming to the second arch, what are the muscle derivatives from the second arch? Muscle derivatives from the second arch. So, muscle derivatives from the second arch are muscles of facial expression. All the muscles of facial expression, they are derived from the second arch. So, all the muscles of facial expression. We have more muscles from the facial expression, right? We have zygomaticus major, digomaticus minor is there, orbicularis oculi is there, depressor mentalis muscle is there, levator aliquinasa is there, levator palpebrae superioris is there, so orbicularis oculi, frontalis, all these muscles are muscles of facial expression, right? So muscles of facial expressions are derived from the second arch. And posterior belly of digastric, and stylohyoid, posterior belly of digastric and stylohyoid, these are derived from the second arch. So all these muscles, they are supplied by the facial nerve. We know that the nerve of second arch is the facial nerve and the nerve of first arch is the mandibular nerve. So the second arch muscles, they are derived from the, they are supplied by the nerve of second arch, that is facial nerve. So all these muscles, we know that posterior belly of digastric arises from the mastoid process, here, and stylohyoid muscle, it arises from the styloid process. Okay, so all the muscles of facial expressions, posterior belly of digastric and stylohyoid, these are the derivatives from the second arch. They are the muscles derived from the second arch, which are supplied by the facial nerve, which is nothing but the nerve of the second arch. Okay, and then coming to the muscles derived from the third arch. So the muscles derived from the third arch is only one muscle, that is stylopharyngeus. So stylopharyngeus muscle is the only muscle which is derived from the third arch, which is supplied by the glossopharyngeal nerve, which is nothing but the nerve of third arch. So stylopharyngeus muscle is supplied by glossopharyngeal nerve, which is the ninth cranial nerve. Glossopharyngeal nerve is the ninth cranial nerve, right? So glossopharyngeal nerve supplies the stylopharyngeus muscle, which is nothing but a muscle of, longitudinal muscle of pharynx. Okay, so this stylopharyngeus muscle which is supplied with the glossopharyngeal nerve. The third arch muscle derivative is nothing but the only one muscle, that is stylopharyngeus. And coming to the fourth arch. What are the muscles derived from the fourth arch? All muscles of pharynx except stylopharyngeus. We know that stylopharyngeus, it is supplied by the glossopharyngeal nerve, right? So all the remaining muscles of pharynx, they are derived from the fourth arch. So all muscles of pharynx, they are derived from the fourth arch. We know that all muscles of pharynx, we have superior constrictor, middle, inferior constrictors are there, cricopharyngeus is there. Okay, and the inferior constrictor divides into thyropharyngeus and cricopharyngeus. All the muscles of pharynx, both intrinsic and extrinsic muscles of pharynx, they are supplied by the superior laryngeal nerve and they are derived from the fourth arch. And cricothyroid muscle, which is a muscle of larynx, it is also derived from the fourth arch. That's why the cricothyroid muscle also supplied by the external branch of the superior laryngeal nerve. Supplies all muscles of pharynx as well as one muscle of the larynx, that is cricothyroid. So the muscle derivatives from the fourth arch are all these the muscles of pharynx as well as cricothyroid, which are supplied by the nerve of the fourth arch, that is superior laryngeal nerve. And coming to the, we know that the fifth arch disappears, and coming to the sixth arch. So the sixth arch. So what are the muscles derived from the sixth arch? Are the muscles of larynx. Except cricothyroid. We know that cricothyroid is derived from the fourth arch. So all muscles of larynx except cricothyroid, they are derived from the sixth arch. That's why they are supplied by the recurrent laryngeal nerve, which is nothing but the nerve of the sixth arch. Recurrent laryngeal nerve, which is nerve of the sixth arch. So these are the muscle masses derived from the mesodermal arches. So from the first arch, what are the muscles derivatives? Are muscles of mastication, tensor tympani, tensor villi palatine, anterior belly of digastric, and also mylohyoid muscle. These muscles, they are derived from the first arch. That's why they are supplied by the nerve of first arch, that is mandibular nerve. And what are the derivatives of the muscle from the second arch? So the muscle masses which are derived from the second arch are muscles of facial expression, posterior belly of digastric, as well as the stylohyoid muscle. And these are the muscles, they are supplied by the facial nerve, which is the nerve of the second arch. And coming to the third arch. Third arch muscle is the stylopharyngeus muscle, which is supplied by the glossopharyngeal nerve, which is the nerve of the third arch. And fourth arch muscles, they are nothing but the all muscles of pharynx except stylopharyngeus, and also cricothyroid muscle. They are supplied by the recurrent laryngeal nerve, superior laryngeal nerve, which is the nerve of the fourth arch. And the fifth arch disappears. Coming to the sixth arch, all muscles of larynx except cricothyroid, which are derived from the sixth arch, and they are supplied with the recurrent laryngeal nerve, which is the nerve of the sixth arch. So that's about the muscle masses. And coming to the That's about the muscle masses. And coming to the cartilage elements or skeletal elements of the mesodermal arches. So the first arch is divides into dorsal maxillary process and ventral mandibular part. The first arch skeletal element, they divide into dorsal maxillary process. First arch divides into dorsal maxillary process and ventral mandibular part. The first arch we call it as mandibular arch. We can also call it as the first arch. We can also call it as mandibular arch. The dorsal maxillary process. It helps in the development of face. We will discuss the fate of the maxillary process while we deal with development of face, because this maxillary process, it helps in the formation of cheeks and the part of the upper lip, upper jaw. So and also it also forms a part in the part of the upper lip, because the filtering of the upper lip is derived from the frontonasal process, and the remaining part of the upper lip, it is derived from the maxillary process. So the dorsal maxillary process, it helps in the development of face. It gives rise to upper lip, upper jaw, and also cheeks. And also coming to the ventral mandibular part again divides into dorsal part and ventral part. Okay, so the ventral mandibular part, it is again divides into dorsal and ventral part. And the dorsal part, it ossifies, it extends up to the cartilaginous ear capsule, and the dorsal part of the first arch, it gives rise to malleus and incus. We know that 3 ear ossicles are present, and the 2 ear ossicles, malleus and incus, they are derived from the dorsal part of the first arch, nothing but the mandibular arch. And the remaining part of the dorsal part, it remains as a fibrous membrane, that is called anterior ligament of malleus and sphenomandibular ligament. So the dorsal part forms the 2 ear ossicles, that is malleus and incus, and also fibrous membrane of the dorsal part gives rise to anterior ligament of malleus. This is the anterior ligament of malleus, which is derived from the dorsal part of the first arch, and this is the spine of the sphenoid, which gives attachment to sphenomandibular ligament, which extends up to the lingula of the mandible. Sphenomandibular ligament. Okay. And coming to the ventral part. The ventral part of the first arch, it helps in the formation of the mandible. So the ventral part of the first arch forms the body ramus of the mandible, which extends from the mandibular foramen to the mental foramen. So the body of the mandible is developed from the ventral part of the first arch. Okay, and the dorsal part of the first arch forms the incus, malleus, and from there a fibrous membrane extends, that is anterior ligament of malleus, which gives rise to anterior ligament of malleus and sphenomandibular ligament. So anterior ligament of malleus and sphenomandibular ligament are derived from the fibrous membrane of the dorsal part, and the malleus and incus get ossified. The dorsal part gets ossified to form the 2 ear ossicles, that is malleus and incus. And the ventral part forms the body of the mandible and the ramus of the mandible. Then coming to the second arch. Second arch we call it as hyoid arch. It also divides again into dorsal part and ventral part. The second arch is also divides into dorsal part and ventral part. Second arch divides into dorsal as well as ventral. The dorsal part, it extends up to the cartilaginous ear capsule and it forms one ear osticle, that is stapes. Stapes forms from the dorsal part of the second arch, and also it gives rise to styloid process and stylohyoid ligament. The dorsal part forms the stapes, styloid process and stylohyoid ligament. They are derived from the dorsal part of the second arch. Stapes, then we have styloid process here, which is nothing but a part of temporal bone. Styloid process, and one is from the styloid process to the hyoid bone, one ligament extends, that is stylohyoid ligament. They are the derivatives of the dorsal part of the second arch. And coming to the derivatives of the ventral part of the second arch. Second arch divides into dorsal part and ventral part. And coming to the derivatives of the ventral part of the second arch, we have upper part of the body of the hyoid bone, upper part of hyoid bone, as well as lesser corner of the hyoid bone, lesser corner of the hyoid bone, as well as the upper part of the hyoid bone, which are derived from the ventral part of the second arch. We know that the hyoid bone is like this. So the hyoid bone is the body of the hyoid bone. These are the lesser corner of the hyoid bone, and these are the greater corner of the hyoid bone, right? The lesser corner and upper part of the body of the hyoid bone, they are derived from the second arch ventral part. And coming to the third arch. So the second arch divides into dorsal and ventral parts. The dorsal parts forms the stapes, styloid process and stylohyoid ligament, and the ventral part forms the upper part and lesser corner of the hyoid bone, upper part of the body of the hyoid bone and lesser corner of the hyoid bone. And coming to the third arch. Skeletal elements. Coming to the third arch skeletal elements. The third arch skeletal element, so this is the first arch, second, third, fourth, fifth, sixth, right? So third arch, it forms the dorsal part, it is disappears, the dorsal part degenerates, and the ventral part only forms the lower part of body of hyoid bone and greater corner of the hyoid bone. We know that hyoid bone has lesser corner as well as greater corner. So the upper part is derived from the second arch, and the lower part, greater cornu, and the lower part of the body of the hyoid bone derived from the third arch. So the third arch skeletal elements are the dorsal part of the third arch disappears, and the ventral part forms the lower part of the body of the hyoid bone and greater corner of the hyoid bone. And coming to the fourth arch. The fourth arch forms the thyroid cartilage. The third arch forms the thyroid cartilage. Sometimes in some books, fourth and fifth cartilages together forms the thyroid cartilage, thyroid lamina of the thyroid cartilage. So sometimes fourth and fifth arches, they together forms the lamina of the thyroid cartilage, and sometimes the fifth, we know the fifth arch disappears and fourth arch alone participates in the formation of the lamina of the thyroid cartilage. So anyhow, the fourth arch forms the lamina of the thyroid cartilage. Sometimes the fifth arch also involves in the formation of thyroid cartilage. So the fourth arch, it is involved in the formation of thyroid cartilage, and the fifth arch usually it is transitory, and in some books it has given that fourth and fifth arches together forms the lamina of the thyroid cartilage. Okay, and coming to the sixth arch. Sixth arch skeletal elements or cartilage elements are, if they gives rise to cricoid cartilage as well as the arytenoid cartilages. These are the cartilages of larynx. These are the thyroid cartilage, cricoid cartilage and arytenoid cartilages, and these are the cartilages of larynx, cricoid cartilage and arytenoid cartilages. So these are the derivatives of the arches, nothing but they are derivatives of the cartilage elements or skeletal elements. Okay, so that's about the mesodermal arches. So mesodermal arches, these cells are pluripotent. They may give rise to aortic arches, muscle masses and skeletal elements. And also each arch is traversed cranially by one nerve, that is post-traumatic nerve, and caudally by one nerve, that is pre-traumatic nerve. Usually the pre-traumatic nerve of all the arches disappears except for the first arch, it remains as the cauda tympani nerve. These pre-traumatic and post-traumatic nerves, they are derived from the hindbrain vesicle. So that's about the mesodermal arches. Okay. So coming to the mesodermal arches are over, and coming to the ectodermal clefts. Totally we have 5 ectodermal clefts are present. Out of this, fifth one disappears. So totally we have 4 ectodermal clefts are seen. So all the ectoderm covering the first arch. The ectoderm covering the first arch, mesodermal arch, it forms the skin over the lower lip, lower jaw, upper cheek and upper lip. So the ectoderm of the first arch, it forms the skin of the lower lip, lower jaw, upper lip and upper jaw cheeks. Okay, and also the ectoderm here at the angle of the mouth, it proliferates into the mesenchyme. The ectoderm at the angle of the mouth, it proliferates into the mesenchyme. Later on what happens is these ectodermal cells, they degenerate. So it helps in the formation of alveolabial sulcus, which is nothing but a gap between the teeth and the lips, that is the alveolabial sulcus. So the ectodermal cells at the angle of the mouth, they proliferate and they enter into the mesenchyme. Later on what happens is these ectodermal cells degenerate, thus helping in the formation of alveolabial sulcus. And the first ectodermal cleft only persists, and the remaining all the ectodermal cleft, they degenerate. So only first ectodermal cleft persists and remaining all the ectodermal clefts degenerates. And the first ectodermal clefts, it forms the cuticular layer of the tympanic membrane. We know that the tympanic membrane is made up of it is a derivative from all the 3 germ layers. It is derived from both ectoderm, endoderm and mesoderm. So the ectodermal cleft, here we know that we have mesodermal bar is present, mesodermal arch is present, and the red ones are the endodermal lining. So here is the formation of the tympanic membrane. So the first ectodermal cleft, it forms the cuticular layer of the tympanic membrane. Thus the tympanic membrane, it is derived from all the 3 germ layers, both ectoderm, endoderm and mesoderm. Okay, and remaining all the ectodermal cleft degenerates. Okay, and sometimes what happens here is the ectodermal cleft of the second arch grows and it overlaps all the ectodermal clefts of all the 3 arches, and the growth behind the growth of the second arch, we have a sinus, that one we call it as cervical sinus. Okay, so usually all the ectodermal clefts disappear except the first ectodermal cleft persists and it forms the cuticular layer of the tympanic membrane. Okay, and coming to the endodermal pouches. So coming to the endodermal pouches, first endodermal pouch. First endodermal pouch. So what are the derivatives of the first endodermal pouch? So the ventral parts of the first, second and fourth pouches, they helps in the formation of tongue. We know that the tongue is developed from the lingual swellings and tuberculum part and the hypobranchial eminence. So the ventral part of the first, second and the fourth, for all the 4 pharyngeal pouches, we know that fifth one disappears, and the ventral parts of all the pharyngeal pouches, they help in the formation of tongue. We know that the ventral part of the first arch, it forms 2 swellings, 2 lingual swellings and tuberculum impart. They form the anterior 1/3 of the tongue, and the second, third, fourth arches proliferate to form another swelling, that is called hypobranchial eminence, and the cranial part of the hypobranchial eminence, which forms the posterior 1/3 of the tongue. We have discussed them in the development of tongue. The first pharyngeal pouch, ventral part, it helps in the formation of tongue, and the dorsal part, it forms together with the dorsal part of the second pouch, it forms a recess, that is called tubotympanic recess. This is the tubotympanic recess. So here it forms one recess, that is called tubotympanic recess. one recess, that is called tubotympanic recess here. The medial part of the tubotympanic recess, it is narrow, and in future it develops into auditory tube. And the ventral and the lateral part of the tubotympanic recess, it is dilated, and it forms the primitive tympanic cavity, which further gives rise to endodermal layer of the tympanic membrane, and also mastoid cell and the mucous lining of the tympanic cavity. They are derived from the first endodermal pouch. So the dorsal part of the first pouch along with the dorsal part of the second pouch, it forms a recess called tubotympanic recess, right? And this tubotympanic recess has medial narrow part and dorsal dilated part. The medial narrow part gives rise to auditory tube, and the dorsal dilated part gives rise to primitive tympanic cavity, which in future it lines the mucous membrane, derivatives of the primitive tympanic cavity. It lines the mastoid 8 cells and also mastoid 8 cells and also mucous layer lining the tympanic cavity, and also endodermal layer. They are derived from the primitive tympanic cavity. Okay, and here the ectoderm of the first cleft, it comes in contact with the primitive tympanic cavity, and here the cuticular layer of the ectoderm. Here the tympanic membrane is present, which is derived from the 3 germ layers. Okay, the blind end of the tubotympanic recess, it projects into the ectoderm. Thus here we have tympanic membrane is present. So the dilated part is called primitive tympanic cavity, which gives rise to mastoid anthem and mastoid 8 cells, and also it forms the mucous lining of the tympanic cavity, and also it forms the endodermal layer of the tympanic membrane. These are the derivatives of the first pouch. Okay, and coming to the second pouch. Coming to the second endodermal pouch, we know that the second pouch also participates, the ventral part of the second pouch also participates in the development of the tongue, and the dorsal part again divides into dorsal wing and ventral wing. The dorsal wing, it helps in the formation of tubotympanic recess. The dorsal wing, it helps in the formation of tubotympanic recess along with the first pharyngeal pouch. And coming to the third pharyngeal pouch. And one more thing is, from the second pouch, it also forms tubotympanic recess, and the ventral part gives rise to tonsil. The ventral part of the second pharyngeal pouch, it gives rise to tonsil, and from the third pharyngeal pouch, from the dorsal wing, it gives rise to inferior parathyroids and thymus. Inferior parathyroids and thymus. They develop from the first, second and third pharyngeal pouch. The third pharyngeal pouch, this is the third pharyngeal, first, second and third. The third pharyngeal pouch, it gives rise to inferior parathyroids as well as the thymus. This is the third pharyngeal pouch, which gives rise to inferior parathyroids as well as the thymus. And coming to the fourth pharyngeal pouch. We know that this one disappears, the fifth one disappears. So coming to the fourth pharyngeal pouch. The fourth pharyngeal pouch gives rise to superior parathyroids, and also the fourth pharyngeal pouch together with the fifth pharyngeal pouch sometimes forms a complex called caudal pharyngeal complex. So sometimes the fourth pharyngeal pouch together with the fifth pharyngeal pouch forms a complex called caudal pharyngeal complex, and this caudal pharyngeal complex helps in the development of thymus as well as the thyroid gland. Helps in the development of thymus as well as the thyroid gland. And from the caudal pharyngeal complex, one branchial body arises, that is called ultimobranchial body. Usually, before we think the parafollicular cells, they are C cells, they are derived from the ultimobranchial body. But recent investigation said the parafollicular cells or C cells, they are derived from the neural crest cells. They are not derived from the ultimobranchial body. So the caudal pharyngeal complex is formed by the union of the fourth pharyngeal pouch with the fifth pharyngeal pouch. So the fourth pharyngeal pouch along with the fifth pharyngeal pouch, it forms the caudal pharyngeal complex, which gives rise to thymic rudiment, which helps in the development of thymus, lateral thyroid rudiment, which helps in the development of thyroid gland, and also ultimobranchial body. Ultimobranchial body, it is seen in vertebrates. Compared to humans, it is seen in vertebrates. It is it formerly thought as the ultimobranchial body. It gives rise to parafollicular cells or C cells. Now they are dead. Now recent investigation shows that this ultimobranchial body, it derived from it gives rise to it doesn't give rise to C cells, and they are derived from the neural crest cells. So these are the derivatives of the endodermal pouches. So the first endodermal pouch, dorsal part, and from the endodermal pouch of the second part, dorsal part, together forms the tubotympanic recess. So the dorsal parts of the first pouch, dorsal part of the first pouch, and dorsal part of the second pouch together forms the tubotympanic recess. Right. This tubotympanic recess gives rise to auditory tube and also primitive tympanic cavity. This primitive tympanic cavity, in future it gives rise to mastoid anthem, mastoid air cells, and mucous lining of the tympanic cavity, and the inner layer or endodermal layer of the tympanic membrane. Okay, to the dilated end of the tubotympanic recess, the ectodermal clefts come here and forms the first ectodermal cleft come here and forms the cuticular layer of the tympanic membrane. And next is the coming to the second pouch. We know that the dorsal part of the second pouch involves in the formation of tubotympanic recess, and the ventral part of the second pouch, gives rise to ventral wing of the second pouch, which gives rise to tonsil. Okay, and coming to the third pharyngeal pouch. We know that the ventral part of the third pharyngeal pouch, it involves in the formation of tongue. And coming to the dorsal part again divides into dorsal wing and ventral wing. Okay, and the dorsal wing gives rise to inferior parathyroids, and ventral wing of the dorsal part gives rise to thymus. Okay, the dorsal wing of the dorsal part gives rise to inferior parathyroids, and the ventral wing, they gives rise to thymus. Okay, because these are inferior parathyroids are derived from third pharyngeal pouch, because these inferior parathyroids and thymus, they descend along with the heart. Because we know that the thymus, we can see it is a lymphoid organ, we can see in the superior mediastinum. So the thymus and inferior parathyroids, they descend along with the descent of the heart. Okay, and coming to the fourth pharyngeal pouch also, the ventral part forms in the formation of tongue. And coming to the dorsal part, it gives rise to superior parathyroids. The dorsal part of the fourth pouch along with the fifth pouch forms a complex called caudal pharyngeal complex. This caudal pharyngeal complex gives rise to three derivatives: thymic rudiment, lateral thyroid rudiment, and also ultimobranchial body. Thymic rudiment helps in the formation of thymus, which is derived from the third pharyngeal pouch, and lateral thyroid rudiment helps in the formation of thyroid gland. We know that the thyroid gland develops from a thyroglossal duct. We know that behind the tuberculum impar, we have the depression called thyroglossal duct descends down to the depression, and depression we call it as foramen cecum, and the thyroglossal duct descends downwards, and from the thyroglossal duct thyroid gland develops, and the derivatives of the caudal pharyngeal part, they also helps in the formation of thyroid gland. And the third derivative is the ultimobranchial body. This ultimobranchial body is seen in more vertebrates, and at times in future we thought these parafollicular cells, they are derived from the ultimobranchial body, but the fact is these parafollicular cells, they are derived from the neural crest in origin. Okay, so that's about the pharyngeal pouches and Mesodermal bars is over, derivatives of the mesodermal bars, endodermal pouches is over, ectodermal clefts. Out of this only first cleft remains, and it forms the epithelial lining, it forms the cuticular layer of the tympanic membrane, and the ectoderm covering the first arch, it forms the skin over the lower lip, lower jaw, upper lip and upper jaw, and the remaining all the ectodermal clefts disappears. Sometimes what happens here is the ectodermal clefts of the second arch, it grows over the all the two arches, and the space behind that we call it as cervical sinus. So, and the endodermal pouches, they help in the formation of tongue. The ventral parts of all the endodermal pouches helps in the formation of tongue, and the remaining part, the first endodermal pouch gives rise to tubotympanic recess, along with the second pouch which gives rise to auditory tube and primitive tympanic cavity, and the third pharyngeal pouch, it gives rise to dorsal wing of sphenoid. The dorsal wing gives rise to inferior parathyroids, and the ventral wing gives rise to thymus, and the fourth pharyngeal pouch gives rise to superior parathyroids as well as the caudal pharyngeal complex, which helps in the development of thymus and thyroid gland, and also albobranchial brody, it is also derivatives of the caudal pharyngeal complex. This is all about the branchial apparatus. So, totally branchial apparatus consists of mesodermal bars, endodermal pouches and ectodermal clefts. These three together forms the branchial apparatus. These mesodermal bars, they extend ventrally and medially from the floor of the primitive pharynx. Extend medially along the floor of the primitive pharynx in the mid-ventral lane, where they meet the opposite mesodermal bar. Okay, so that's about the pharyngeal arches, or nothing but branchial apparatus.